All right, everybody. Welcome, welcome, welcome to another Sunday of When Black Women Gather. This weekend, I'm happy that we're gathering with our Black male colleagues as well. It's not just us. And I'm actually going to be co-hosting today, which is good since I'm having camera problems. This is Miss Higgy, for those of you who don't know, talking from a dark place, but I'm really here. And so this week, my co-hosts who will be taking over are Kylthia Roberts, and we have Michele Burgess and Angela Wyatt. So those are going to be the people who are going to be hosting this program and telling you what it's all about and what we're here for. You got my email, so you know that our topic today is mental health. This is the third in a series of 4 conversations that we're going to have around mental health. And today's topic is about police responses in matters of mental health. And I think we're all aware of the many cases that have not gone so well. So I'm very happy to have with us guests who are working in the field, who can tell us some nuances and new developments that have happened, and just how they're trained to respond to these kinds of situations. So I'm going to be quiet, and I'm going to turn it over. Let me just highlight my 3 co-hosts, and they will, and Angela, I saw you, there you are. These are the 3 ladies who will be guiding us in discussion today. And they will introduce our guests. And as I said, if you don't want to be recorded, now's the time to turn off your camera and or change your name to something that nobody knows it's you. As always, this is a conversation that can get sensitive, so we need to be very mindful of that and respectful of what other people say. As you know, all comments are welcome in this forum. We don't have to be comfortable with everything that's said, but we must be respectful of everything that's said and everyone who's here. So on that note, I'm going to stop talking and you guys take it from here. And thank you, ladies, for doing this. I really appreciate it.
Great. Thank you so much, Ms. Higgy, for being open to suggestion. And as you said, this is the 3rd in a series of 4. And so I don't want to kind of leave people out. Michele, I'm not sure, and Angela, I'm not sure what your thinking is, but maybe we should just tell people what the schedule is going to be, what the order is going to be, and then I will introduce Giles.
Okay.
You want to start, Michele?
Well, sure. The schedule today is going to be Giles we're going to have 20-minute sessions, each speaker, and Mr. Giles Shipp will go first and talk about Noble and some of the initiatives going on with that. And then we'll have 2 speakers from Durham, Lieutenant Tait and Abena, I'll get it right, Bidiako from Durham to talk about what the initiatives going on in North Carolina. And then we have Dawn Thomas, Brown. I can say Brown. Dawn Brown, sorry, who's going to share with us what NAMI is doing on a national basis. Thank you very much, speakers, for being here.
Okay, great. So I'm going to introduce Mr. Giles Shipp. He's going to come on and talk to us some about his background and some about the initiatives that are going on here in New Jersey to address policing and mental health in the Black community. Commissioner Giles Howard Shipp currently serves on the New Jersey Police Training Commission. In addition, Mr. Shipp is principal and CEO of a public safety management firm, Homeland Global Strategies, LLC, and has recently completed an assignment for the U.S. Department of Justice. Giles Shipp served over 25 years in the field as a sworn law enforcement officer. We are pleased to have an individual with such broad experience and expertise in law enforcement. Mr. Shipp held many positions, has received many awards. In 2004, Mr. Shipp was appointed to be the Director of Public Safety for the City of Plainfield. In 2011, Director Shipp was elected to serve as the 34th President of the National Organization of Black Law Enforcement Executives, also known as NOBLE. Directorship is a subject matter expert in the field of law enforcement. He is currently an adjunct professor at Rutgers University School of Criminal Justice. He is a proud member of the Omega Psi Phi fraternity. Mr. Shipp served his country as a U.S. Marine Corps Reserve. Let's welcome Giles Howard Shipp back to When Black Women Gather to address this critical issue of police response to mental health issues in the Black community. Thank you for coming.
All right, thank you for having me. I'm glad that you have taken up this very important topic. But what I like to say first, I'm just going to give a little more detailed thumbnail sketch of my background as it relates to discussion today. I served initially over 17 years with the Edison Police Department and predominantly in the patrol division in various different capacities. Why is that important? That's important because we are generally the first responders to come to a scene if there's a shooting, call for any type of assistance, if there's a call for anything you can possibly think of. We generally are the first persons to respond, the patrol division. And it depends on what type of job it is. If it's a job in progress, broken window, accident, we typically may send a one-man unit or a one-person unit. If it is a crime in progress, bank robbery, fight, emotionally challenged person, we would send a two-man unit or a two-person unit to that job to make sure the proper support is there for the officer that's arriving on the scene. In addition to that, I also served in various different capacities with the New Jersey Attorney General's office as a supervisor over a number of different units, everything from corruption, gangs, guns, and drugs initiatives out of law enforcement services, coordinated efforts with the federal, state, and local law enforcement agencies to address the problems that we had in our communities at that time. And as you heard also, I served as a director of public safety for the city of Plainfield with the responsibility over 250 sworn personnel and 56 civilians. Now, all of that's being said, just to give you the context of the experience I've had, we have had to, this is not a new phenomenon to law enforcement and dealing with people who have mental health challenges. We've always dealt with that. But one of the most important things that I think, or quality that a person could bring to this job that has to respond to that type of incident is, I'll share an anecdote with you that my mother shared with me when I first, when she pinned a badge on me when I first came on the job, my first law enforcement job. She said, when you come to a scene, now she had no law enforcement experience. She just raised 7 children in an underserved community. She says, when you come upon somebody, whether you interact them in a motor vehicle stop, you come up to them on the street, she said, or you respond to their home for a call. She says, your safety is always paramount. But she said, treat everyone as though you would want your mother, father, or sister or brother treated. And she said, if you apply that philosophy, you'll do fine in this job. So I said that to say this is that all of my career, I've dealt with, people who had mental challenges. I've dealt with people who resisted arrest. I've dealt with people, I've arrested folks from everything from homicide to auto theft to burglaries, right down to shoplifting and everything in between. I had a multitude of arrests and people I had to deal with. And I treated them with the compassion that you should treat people with, primarily just with dignity and respect. You can still make it, I just got just as many commendations and awards as other law enforcement officers, but I never had one internal affairs complaint because I used excessive force or took any other measures to take a person under control. That being said, I want to talk a little bit about what we're doing in Jersey now. Obviously, with COVID, a lot of people were glued to the TV. And now with the advent of the cameras, there's much more that you can see. It's not anything that's new. It's just that now it's, there's a way of recording it and reproducing it to show it to millions of people. So let me talk a little bit about what we did here in New Jersey when this became an issue. We met with the Attorney General, and the Attorney General has now started an initiative. The initiative is called Arrive Together. And it's an acronym. Arrive is an acronym for alternative responses to reduce instances of violence and escalation. And we began that initiative in the southern portion of the state with the state police and Cumberland County prosecutor. And Cumberland County, they have about 5 police departments in that area. And the other area that's not patrolled by the local police is generally patrolled by the state police. So they paired up professionals in the mental health area with law enforcement officers, and they arrived on that particular job together. Now, law enforcement officers are not actually trained in an extensive way to deal with people who have mental health problems. So what we try to do is get to the scene and to secure the scene until the proper health comes there. When I was working the road, we kept the scene safe until the EMTs came, the medical responders. Subsequently, what we did, we took that person into custody. We took them to the nearest hospital where a professional could make an evaluation. And then subsequently, they made a determination from that point whether they were going to have to be released or whether they were going to have to be kept in their custody for more treatment. And that was based on if you're a danger to yourself or to another person. That's how that decision was generally made. So as I said, we responded to many calls like that. Fortunately, none of the ones I responded to led to a death in custody. Now, additionally, what the Attorney General, there was a pilot program that was started in Southern Jersey and Cumberland County. It was based more so in Bridgeton and Port Norris, if you're familiar with South Jersey. Now the program has expanded. Under the expansion, a screener from Trinitas Hospital, it's expanded now up to Elizabeth and Linden, New Jersey. And part of the expansion is with a screener from Trinitas Medical Center. They travel in plain clothes with the Elizabeth or Linden police officer in an unmarked vehicle to respond to 911 calls for service relating to mental or behavioral health crisis during all shifts, evening, day, and afternoon. So they arrive together. The shifts will be held 2 times per week right now on days alternating between the police departments. And as I said, the idea with that program is to have a professional arrive at the same time that a police officer arrives, so we can actually make a quicker evaluation versus taking that person into custody and then taking them to the hospital and having the hospital make that evaluation. So I think it's a great program. Anything that we can do that creates a safer environment, number one, and anything that we can do to preserve life, I think it's a win-win, not only for law enforcement, but also more particularly for the community. We have made some changes in New Jersey. Do they go far and fast enough? That's debatable, even by us in NOBLE. So you also know that NOBLE is an acronym, as you heard earlier, for the National Organization of Black Law Enforcement Executives. We're an organization of over 5,000 members of federal, state, county, and local law enforcement officials. I'd like to tell people we're not a bargaining agent. We're not like an FOP or PBA, any type of union. We're not a bargaining agent. We're an organization of, most of us patrol the areas, high crime areas. Most of us, the difference is though that most of us also grew up in those areas where there's a lot of challenges for those respective communities. So a couple of things that we do in Noble. One is we mentor people so they can become chief executives in law enforcement agencies. Two, we monitor legislation and policy to make sure it's fair and equitable to all communities, with a special emphasis on the African-American community. So why do I say that? To let you know that any time a policy is developed, either by the New Jersey Attorney General or the federal government, Department of Justice, Noble is at that table. Do we always get it the way we want it? Not necessarily, but we're part of that discussion. And just the fact that knowing that we're at that table and we giving the input that we give, I think it's going to make that legislation or that policy or legislation in other cases, because we work closely with the Congressional Black Caucus as well. It's going to make that policy better for all communities, but also additionally for our community. So when the Attorney General put this together, there was some pushback, from law enforcement, but we insisted on moving this forward in a pilot and making sure, and we had the Prosecutors Association also in support of this. So we moved it forward, and hopefully it's going to bring a lot of success, and more importantly, as I said earlier, provide one for getting people the assistance they need, and also ensuring the sanctity of life. So I'll stop right there for now. If anyone has any particular questions, or however you want to do the Q&A part, I'll stop right there for now.
Thank you so much, Giles. We appreciate your presentation and sharing what's happening in New Jersey. And that sounds like an exciting program that hopefully will ally some, put aside some of the issues that we've had in communities. Unless someone has a burning question, okay, let me see. There's something in the chat. No, okay. Does anyone, okay, so Judy asks, what is the reason for the pushback?
Well, the reason for the pushback is anytime you bring about change, it's unfortunately, you're going to get some pushback, especially with law enforcement organizations. We all know the history of law enforcement, if you want to take it back to 1619 and how it was created. And but the way you address that is by people showing up. We tend to forget, that police officers are here to serve you, and unfortunately, we don't get, when the legislative hearings are going on, when policy decisions are being made, our community is quiet. They're not at the table, and some people say, well, how do you get at the table? You just get involved. You city council meetings, you go to your hearings. You can go online now and send in your respective comments, because trust me, if you're not at that table, you're going to be on the menu. I'm going to tell you right now, that's the way it works. And as Shirley Chisholm said before, if they don't give you a seat at the table, bring a folding chair, but make sure that your position is heard, and you have to demand what you want.
The
pushback is basically because people are creatures of habit, and they don't necessarily want change. But until we start holding people to a level of accountability, these things are going to continue to repeat themselves.
You're saying the pushback is actually coming from the officers then? That's the question, is pushback coming from the officers or the union?
Yes, the law enforcement community.
From the community, okay, great.
Law enforcement community.
Law enforcement community, thank you, Giles. I think that there is another question, but I think that it may go better. Is anyone else watching? Michele, should we leave the next question for the overall Q&A?
It'd be great if we could push that to the Q&A. That'd be good.
Yeah. Okay. So thank you so much, Giles, for sharing your expertise with us. And we're going to turn it over to Michele now to introduce.
If I could, this too, somebody said was pushback from the officers or the union. Well, it's generally the union that represents the officers.
Okay, that's good. Thank you for clarifying that. I think we'll turn it over to Michele now to introduce the team from Durham. Thank you so much, Giles. And so I see Miss B, I guess, is lining up.
Good.
Yeah, there you go. Okay.
Okay, good. All right, thank you. So good afternoon, everyone. I'm Michele Burgess, and having lived in New Jersey for many moons, I am now with my family in Durham, North Carolina. And doing the research of this topic, I think Angela brought to my attention that Durham had a woman police chief, and I researched it, and sure enough, we have the first, I think she's the first Black woman police chief, Patrice Andrews, and I'm really thrilled to announce that. She had obligations today, but our next two speakers came very highly recommended. And I am thrilled to bring you two of Durham's finest to talk about two police and mental health initiatives here in Durham, the CIT and HEART programs. And with that, it's going to take a few minutes to introduce them because I want you to understand the breadth that these ladies bring to the table. So I'll start with Lieutenant Quincey Tait. Lieutenant Tait received her Bachelor of Science degree in criminal justice. What happened? Okay. From North Carolina Central University and her Master's of Science in Criminology from Indiana State University. Lieutenant Tait began her law enforcement career with the Durham Police Department in August of 2008. She was assigned to the Uniform Patrol Division for 4.5 years, and her career began a series of promotions, transfers, and assignments as follows. Criminal Investigations Division, investigating property crimes, to violent crimes, to Special Victims Unit, where she investigated sexual assaults and crimes against children. She established a partnership with End Violence Against Women International and launched the Start by Believing campaign for Durham Police while assigned to SVU. The purpose of this campaign focused on the way society responded to victims of sexual assaults. She transferred the homicide unit where she investigated homicides, suicides, and natural deaths. Promoted to the rank of corporal, she was assigned to the Uniform Patrol Bureau, and another transfer to the training division where she served as the police training officer coordinator. Promoted to the rank of sergeant, she was assigned to criminal investigation division and special victims unit. She was responsible for investigating all sexual assaults, crimes against children and the elderly, and domestic violence. She later transferred to the homicide unit. Promoted to the rank of lieutenant, Lieutenant Tait was assigned to the public affairs unit, responsible for media relations, writing press releases, and coordinating press conferences. Lieutenant Tait has received awards, including a National Shining Star from the National Organization of Black Law Enforcement Executives, NOBLE, in 2021. Her additional training includes an Advanced Law Enforcement Certificate, West Point Leadership Program at Methodist University, and the Federal Bureau of Investigation Law Enforcement Executive Development Association. Lieutenant Tait is a member of NOBLE, where she serves as the associate member for the Eastern North Carolina chapter and the International Association of Chiefs of Police. So welcome, Lieutenant Tait. And I will introduce Ms. Abena Bediako. Ms. Bediako is a licensed clinical social worker with over 20 years of experience in the mental health field. She earned her Bachelor's of Arts from the College of William and Mary and her Master's of Social Work from Howard University School of Social Work. Since that time, she has provided clinical services to children, adolescents, and adults in multiple settings. Ms. Bediako currently serves as clinical manager with the Durham, North Carolina Community Safety Department in this role. She manages two of the department's 4 alternative response programs, co-response, and community response team, helping to ensure neighbors receive the appropriate responses to their crises. In addition, her business Loves Therapeutics is a plant-based body care line that utilizes aromatherapy for therapeutic healing, and she also assists families in the role of a doula. Ms. Bediako is a published author and a former vegan caterer. Her mission is to be a vessel to folks to help guide them on their journey of healing. Her motto is, we all have within ourselves the ability to heal. Sometimes we just need a little guidance. So please help me welcome Lieutenant Tait and Miss Bediako. Thank you very much, ladies. And Lieutenant Tait, take it away.
All right, good afternoon, everyone. I hope everyone is doing very well today. First and foremost, I do want to thank everyone for at least allowing the Durham Police Department to have a seat at this table and actually share some of the initiatives that we have been doing when it comes to responding to mental health and in our communities. I know that myself and Ms. Bediako will be kind of splitting time a little bit, but just kind of an overall overview. We as a department, we recognize the need, kind of like what Mr. Shipp was saying, that we needed to do something else when it came to responding to individuals who are experiencing mental health crisis. So we started off with partnering with the National Association for Mental Illness, NAMI. We have certified a number of officers for the crisis intervention team. And it's pretty much a 1 week long class where they are thrown into trying to learn how to respond to mental health, people having mental health issues, how to recognize if someone's experiencing or are in crises. We, instead of just throwing out a training announcement and saying anybody that is wanting to go or wanting to attend the class several years ago, we now have now had the training, folks that are graduating from the academy as part of our after academy training. So after they have graduated from the basic law enforcement training class, after that, we have a couple of weeks of series of other classes, but now we have incorporated the CIT class in there for them as well. So when they're leaving out of the academy and first getting assigned to uniform patrol in their training phase, they already have had this class. It's not as extensive as the licensed clinicians, obviously, that we have, but it is something that we are trying to do as a department to address these issues early on with our officers. We have started another pilot program. Ms. Bediako will really be able to explain a lot of that, but it's kind of like the Arrive Together program that Mr. Shipp was just talking about. It's a co-response. So we would have a CIT officer respond at the same time with somebody who is a licensed clinician to deal with some of these calls. And some of the calls for service could be as simple as a trespassing call or a disturbance with the weapon call, any call that requires or we think is someone experiencing mental health. We would have a CIT officer along with a licensed clinician respond to that call together. Once the scene is deemed safe, the clinician can obviously start what they need to do, start talking and interacting with this particular individual. I know that Dr. Burgess, you wanted me to talk about some of the things that we were doing as well for our officers. And it is important that we do take care of ourselves as well, because while we are trying to help out individuals experiencing mental health crisis, we have to make sure as officers responding that we're taken care of as well. So some of the things that we have, the employee assistance program, everyone knows about that. They offer 8 to 12 classes or 8 to 12 sessions that officers can use for free. The FMRT program, which is really fit for duty if a supervisor or another officer sees that an officer may need some additional help, because there's a lot of stigma on therapy and mental health and actually want to address that. A supervisor or another officer could say, okay, well, let's go to FMRT and go through a fit for duty, which is a psychological evaluation to see if they're okay to continue to do this job. And if they need help with the job, that's okay as well. But we at least have those services offered. We have recently started a peer support specialty program as well, which is comprised of officers who have seen the need to want to assist other officers that may not want to go to a therapist, because for whatever their reasons are. Sometimes officers, we want to think that officers can only assist officers, and the therapist may or may not understand what we're going through. And so what we have done is a peer support group comprised of officers of all different ranks. It's anonymous. It's non-reported unless, of course, it rises to the level of needing to report an issue. They can talk to peers and still get that same amount of help. Those are the three main things, or the four main things that we are doing for officers to help with mental health as well.
Okay, thank you, Lieutenant Tait. At this point, are there any questions in the chat, or otherwise I'll go ahead and suggest Ms. Bediako start. It says, when do the programs begin? I guess that's for you, Lieutenant Tait.
Which program?
And this is Kylthia.
The CIT and the HEART program. How long have they been doing?
Well, I can definitely speak on that. Yeah. Thank you, Lieutenant Tait. Just to offer, and thank you for having me as well. I'm happy to be here and to share space with each of you. To add on to what Lieutenant Tait shared about the Durham Police Department, I just want to go back and just add that in addition to joining with our community safety department to initiate the co-response program that actually will start tomorrow, Durham actually had a co-response model previous years ago, and then due to funding, it was pretty much stopped and taken away, but then brought back again in 2018. And that's where I came into contact with the Durham Police Department. At that time, I was leaving one position and I saw this opening, and it was during the time of George Floyd and pretty much the height of Black Lives Matter and the visual of the brutality that was happening. And I saw that this would be a perfect opportunity for me with my background to come into. And I served for 3.5 years as the only clinician embedded within the police department. And I was paired with the CIT unit, where we went out and we answered live 911 calls and did follow-ups and went out into communities and did trainings and workshops and things like that. And I always like to highlight that because I'm very proud of Durham and the Durham PD and the framework that was laid prior to the community safety department being born. And as Ms. Burgess has shared, my current role is as clinical manager with the Durham Community Safety Department. In 2020, I think it was, our newly elected city manager, Wanda Page, who is also a Black woman. Very happy about that. Durham has a Black chief, Black female chief, Black city manager, and a Black female mayor. So very proud of Durham. But at that time, she created a new department, the Community Safety Department. And this department was created to be a fourth alternative response to 911 calls. So in addition to law enforcement, EMS, and fire, Durham now has HEART responders. And over a year, there was evaluations completed, there was data gathered, folks talked to community members, and all of that information was taken and pretty much started the department. We launched in the end of June of this year, and we have 4 programs. we have our crisis call diversion program. That's where a licensed clinician is embedded within the community call center. They answer calls, they help to de-escalate situations, stabilize situations, connect neighbors, that's who we call our individuals that we serve, our neighbors, to resources in the first moment of contact. Our second program is our community response team. That is our program in which a licensed clinician, a peer support specialist, and an EMT is paired together, and they take live 911 calls. And I think it was Lieutenant or Sergeant Ship, I forget your title, so pardon me, that mentioned having persons with lived experience doing the work. And we also see that need and see how valuable it is to the community, which is another reason why we have the 3-person team and have peer supports in that role. And again, they take live 911 calls, they go out into the community, Commissioner, thank you. They engage with community stakeholders to also de-escalate calls. And the calls that they take are low-level, non-threatening calls. So they do not take any calls that involve a weapon at all. They do welfare checks, urgent calls, crises, mental health, panhandling, anything that's dealing with mental health crises or the like, they would take that. Our third program is our care navigation. And that is a program that has a licensed clinician, a peer support specialist, and we also have 2 interns that will be with us for this 4-year from North Carolina Central University. And they are paired on that team as well. So once a call comes in through the crisis call center or through our community response team or our co-response team, the care navigators will follow up within 24 to 48 hours and provide a little bit more long-term service. So we have 30 days, possibly more, that we will engage with our neighbors. We will connect them to community health agencies. We will take them to a community-based shower if that's what is needed, to the grocery store and get food, to appointments, whatever it is that we can help fill the holes and the gaps for those neighbors to stabilize and to become a little bit more functioning. That's what our Care Navigator program is for. And our fourth program is our co-response program, which again, we'll be launching tomorrow. And that is where a licensed clinician will be paired with a law enforcement officer. And as Lieutenant Tait has shared, they will take a little bit more intense calls. It may be trespass with a weapon. It may be urgent welfare checks where it may not, a history on that location may be a little bit more unsafe, things like that. And so Durham is the pretty much only city in North Carolina, and I think within the country, that has created and implemented all 4 of these programs and started them at the same time. Co-response has, again, been going on for years throughout the country. There has been folks within the call centers in Houston and some other cities like that. But to take on the challenge and provide a very holistic model, to our knowledge, is we are the first. And so because we understand that when the call comes in, it's very important to de-escalate in that moment and to follow that neighbor throughout as long as possible to help provide a more stable foundation for that individual.
Wow, that is awesome. You know what, I'm sitting here resonating around the term neighbor. I'm wondering if a female came up with that name, because it conveys compassion, it conveys a lot of different things, not adversity in my mind.
Yeah.
So I hear some feedback. I don't know if somebody's asking a question or not, but
Yeah.
I love that. Thank you so much. Are there any questions just yet that we should do, or should we?
We probably ought to tell everyone to mute their phone if they're not speaking.
Yes. Good. Could everyone mute their phone if you're not speaking?
How do I mute the phone?
How?
Yes, how do I mute it?
#6.
#6?
Or *6. It's either #6 or *6.
Thank you.
And you can unmute it the same way when you're ready to talk. Sorry about that.
And I did, pardon me, I did want to just lastly share that we are the HEART responders, and the HEART stands for Holistic Empathetic Assistance Response Teams.
And I just wanted, there's another term too that you may have heard throughout the presentations, CIT, that stands for Crisis Intervention Team, for those who may not be aware.
Yes, thank you for that. Thank you. Thank you both ladies for your wonderful presentations. And at this point, I am going to turn it back over to Kylthia, and then we'll have Q&A after that. Thank you, ladies.
Hang tight, everyone.
Yes, thank you, ladies, so much. So I am introducing now Dawn L. Brown. Dawn Brown is the Director of Cross-Cultural Innovation and Engagement for the National Alliance on Mental Illness, also known as NAMI. Dawn leads a team focused on expanding mental health education and suicide prevention into underrepresented, underserved, and faith communities, and the implementation of prevention into implementation of JEDI class principles and practices across the agency and their 650 chapters. She's a mental health advocate, a DEI trainer, that's diversity, education, and inclusion. You're muted.
I'm sorry, diversity, equity, and inclusion. And you don't even have to finish. I could just
no, I want to finish. Let me and an international speaker on a mission to eradicate disparities and create mental health friendly, stigma-free workplaces of work, worship, and community. In addition to her role with NAMI, she is a mother of a daughter with a serious mental illness, the president of Depression Bipolar Support Alliance, State Board of Directors, a member of Kaiser Permanente National Suicide Prevention Learning Collaborative, and a member of the Suicide Prevention Task Force for the city of Milpitas.
Milpitas, yes.
Thank you so much, and I present to you Dawn Brown. Thank you.
Good afternoon, good afternoon. What a joy to just be sitting in the company of such wonderful folks. Giles, I tell you, hello, frat. I'm excited to be sitting in the space with you. Deep bow to you, Quincey. And Abena, is it Abena? Yes. Abena, thank you for just all that you all are doing. I am with NAMI, which is the largest grassroots agency in the country. We work to really try to make sure that folks understand that there's nothing about us without us, that you're not alone. And as a family member, I stumbled upon NAMI. I have a daughter who has a serious mental illness. And when she first wasn't doing well, I thought, and I adopted her out of foster care. So she came with a lot of trauma. She had, I think, 4 therapists, and we had a lot of work to do. But when she first started not doing so well, I really thought it was just normal teenage angst, in addition to just her trauma. And I went to my pastor, who gave me a book on casting out demons and holy oil, told me to pray. And it really wasn't until probably her 27th hospitalization that somebody was like, have you heard about NAMI? And I had not. I was like, what is NAMI? And NAMI was wonderful. It was like a life raft. And when I joined NAMI, I realized that there was just so much I didn't know, even though mental health and mental illness was prevalent in my family, we called it other stuff. He was pledged wrong, or, you know, she's just sometime, and we just didn't have the language. And so starting at the grassroots level, I started to get involved, and my background really is managing communities, Northwest East Oakland and South Berkeley, that just had an urban texture and a context and often didn't get the services. So it became kind of a mission for me to really figure out, how do we create programs that serve communities like the ones that I was attached to? And how do we make sure that NAMI speaks to everybody? NAMI has a rich, deep history, but their history isn't always in Black and Brown communities. And NAMI's aware of that, and they're trying to make sure that we can address that. And I think some of the ways that we are doing that, you all have already described: our CIT training in partnership with law enforcement agencies, in which we serve about 2,700 communities nationwide. And we've been aware that it's led to about an 80% reduction in officer injuries. We also are doing things like Help Not Handcuffs, which are trying to educate folks around trauma, so that people don't just naturally call an officer when folks are acting out of character, or when trauma shows up as the only option in youth and young adults, and even folks who sit, you know, in public spaces and walk on stage angrily and do things that we probably all gasp about. And I think helping to educate folks just around what it is and what it isn't. My role is really interesting as a DEI trainer, as an individual who's trying to help reshape the inner workings of NAMI, so that we are sensitive to folks who don't always look like our typical consumer that walks through the door, but focus on Black and Brown communities. And we're doing it a variety of different ways. The first is we have a FaithNet initiative that is educating pastors and faith leaders on mental health awareness and suicide prevention. We're aware that folks are going to their, just like I did, going to the pastor, you know, the rabbi, the imam, to say, what is happening? And in our communities, in Black and Brown communities, they really are a part of our family, our community. They guide our value system in many ways. And so we just finished a conference called the Pathways to Hope, which is a conference with NAMI, and we had 15 of our affiliates that are doing grassroots work. So we're trying to make sure that we call them alliances. So members of our alliance might be focused on partnering with a pastor, law enforcement, behavioral health center. Like, how do we get these grassroots efforts to support individuals and their families who walk through the door? So our FaithNet initiative is one that we are really, really, really excited about. The second one that we're doing is Sharing Hope and Compartiendo Esperanza. Sharing Hope is an initiative specifically for the Black African immigrant community. It's comprised of 3 conversations that go into the community to really talk about mental wellness, to talk about wellness, really. And so the first conversation is just kind of unpacking what wellness is and is not. The second one is in partnership with a physician and or clinician, or both. And the third one is really talking about signs and symptoms and what are things that we can do to just be well. So we do this at places like Queensbridge, the largest housing projects in the country. We're doing it at places like Yale, Disney, Kohl's. So we're going in to just educate staff as well, to say, what does it look like to be healthy? What does it look like to have a mental health friendly, stigma-free work environment? And then how do we support the families that show up? Because you can't really focus when your family's not doing well. And so we have the Sharing Hope, Compartiendo Esperanzas for our Hispanic, Latino, Latinx immigrant communities. We're expanding this fall, actually, to Native Alaskan or Indigenous communities and Asian American, Native Hawaiian, Pacific Island community. I think one of the things that we're really trying to do under our Sharing Hope initiative, Sharing Hope is everything Black on Black on Black on Black. It's been a bit of a I think, a new experience for NAMI, because NAMI's not used to having that focus. And so we are really, really excited about helping our alliance to understand how do you reach out into Black and Brown communities? What does it look like? And then how do we make sure it's for us, by us, and about us, right? So how do we make sure that we're the ones leading the community conversations? We're trained facilitators. We have over 50 trained right now around the country to lead these community conversations. And I think one of the things that we're really most, in addition to all of those things, that we're looking forward to is launching our Black Male Mental Health Initiative in partnership with the Confess Project and the African American Male Wellness Agency. In addition to partnering, we just actually are, we are working and we'll be signing the MOU with Delta Sigma Theta Sorority to be part of their program planning and development, to be part of the a charitable partner within the agency to be able to do these community conversations throughout the chapters around the country. We're on, our goal is to get on all HBCUs and expand on all college campuses. We're looking, Brother Giles, to connect with Omega Psi Phi to launch at the national level so that we can also make sure that we are holding these conversations and inviting this dialogue so that we could train the chaplains, we could train sororities and fraternities. All of the D9 is the focus right now. And to make sure that we can start to create these alliances and allegiances so that we can create materials that focus on how do we reach out and educate folks that look like us. What are the words we do not yet have, but how do we describe it? How do we describe it to law enforcement, to educators? So we're partnering with folks like the Ed Trust, folks like Yale, to be able to create information that can go out, Boys and Girls Club of America, to be able to launch Sharing Hope and Compartiendo Esperanza throughout their agency, and to be able to talk to families, especially Black and Brown families, around mental health, mental illness. What is it? How do you get connected to resources? And our focus isn't just trying to get folks connected to NAMI. Our focus is really trying to get folks connected to resources. And we want NAMI to be one of the resources, but NAMI, of the 650 affiliates, needs to be ready to hold the folks that, and receive the folks that come through. So our initiative is really to make sure that, yes, we have these opportunities for family-to-family, peer-to-peer connections, to create support groups specifically for Black and Brown communities, specifically for Black men, specifically for Black women. We are partnering with the Association of Black Women Physicians to be able to invite them in these conversations so we can continue to bring in alignment that the conversation that mental health is indeed physical health. And so a lot of the work that we're doing is really predicated on getting help early and getting the best possible care and reducing the amount of, unfortunate outcomes when folks who are not well encounter law enforcement or just encounter community members, because most folks who have a mental health challenge are usually victims of violence. They're not perpetrators. We hear it a lot, but really they're more apt to be the victims than the perpetrator. So our focus really is rooted in education and expansion in Black and Brown communities. So this fall and this year is what we're focusing on through Sharing Hope, Compartiendo Esperanza, FaithNet, and our Black Male Mental Health Initiative. So I know we're getting close to time, and I'll stop there in case there are any questions.
Can you say a little bit more about the Black Male Mental Health Initiative?
Absolutely. So one of the ways that we are addressing the education of Black men is partnering with barbers. And so through the Confess Project and the African American Male Wellness Agency, we are looking to educate barbers. So when folks go in to get cut up, they could, be talking to a barber who's aware of signs and symptoms and community resources, so they can start to guide folks in that to viable resources. The African American Male Wellness Agency has a walk and they serve a lot of brothers. They serve a lot of Black men. They're out of Cleveland, Ohio. And I think the first year that they started this was like 700 folks. They got up to just under 1 million. In person, they're about 20,000 over the last 3 or 4 years. So there's a lot. And they do mental and physical well-being. So screenings for cholesterol, diabetes, STD, STI, mental health. And the focus is really just overall health and wellness. The barber shops is, we just know when we go in to get our hair done, to get our lines straight, you know, when you sit in a chair, it's just a different experience for all of us, myself included. And you often lay back and you start telling your beautician things you may not even be telling your friends. You just start talking. Once that water hits your head, you start doing all kinds, like, you know, like a truth serum. You start saying all kinds of things. And so we want to also empower our beauticians and our barbers. So partnering with the Confess Project, which is to educate barbers, partnering with the African American Male Wellness Agency to be able to do the same, not just educate and bring together this notion of what does Black male mental health really look like, and how do we start having conversations. What's interesting about the Black Male Mental Health Initiative is that we'll still do the 3 conversations that I spoke about earlier, but the 4th conversation that we want to do to honor our Black men is to invite them to a conversation with a chef where the menu is predicated on the topic, almost like High on the Hog. And so they could sit with a culinary experience and really talk through and talk about, you know, what they've been doing. And it would be the same folks that would be in the first 3 cohorts or conversations, I should say. So I think our focus really is trying to make sure that we represent the community. We're getting in to areas, folks don't generally in communities of color think of NAMI when they think about mental health, mental illness. We think about the American Diabetes Association, the American Heart Association, but we just don't really think about NAMI. So we want to empower our community members to be able to connect folks as needed, and then to get help. They're first responders as well. We'd like to expand this initiative in with law enforcement so we can serve our Black and Brown law enforcement officers to be able to get the help that they need as well, and to fold them into this, you know, initiative to be able to provide support, and then to be able to address what mental health looks like on the HBCUs and on PWIs, on college campuses, I should say. So whether they're predominantly white institutions, whether they're HBCUs, but to be able to start providing young folks with the opportunity to sit in support groups or get connected to resources, therapists, et cetera. So that's kind of what we're up to right now.
You all are doing such fantastic work. I got my camera to work. It was
oh, there you are.
The malfunction was me. I hate to admit it, but I will. But anyway, you all are doing such wonderful work. And so I see that Lieutenant Tait and Giles, you're both Noble. Did you know each other? You know each other before today?
Well, no, we haven't had the opportunity. I know her chiefs, the former chief and the current chief. But it's a pleasure to make this connection.
Absolutely, absolutely. And Ms. Brown, you referenced Noble a couple of times. Are you working with them already or looking to work with them, or?
So members of our team, our CEO and others are connected to Noble. We would like to expand that connection, however, to focus on providing specific resources to Black and Brown officers.
Giles could be your man. Hey.
Giles might be my man.
We've already made the connection, but we did it in a private chat.
All right. Perfect. Perfect. And Abida, I have to give you a shout out as a fellow Bison. Welcome, a personal welcome to you. Okay. So
if I could just say one thing, Ms. Brown, the work that she's doing is incredibly important. And it's so much added value. I'm looking forward to our follow-up, not only with Noble, also with the Divine Nine, because there are so many people in our communities, unfortunately, in all communities, not just ours, in all communities, that go around with mental health issues that have not been diagnosed, you know, and if it's not even diagnosed, you can't even begin to start to help that individual. So the work you're doing is phenomenal, and that approach that you're taking. I'm not going to pretend to be a clinical psychiatrist, but I had the opportunity to look up NAMI, and some of the work that they're doing there is great. And I'm glad you're there at the table to make sure that Black and Brown communities are also going to be able to benefit from that as well.
Thank you so much. I'm looking forward to just all the wonderful stuff, the work that you and Quincy are doing as well, and what we can do, especially when we think about the D9. I mean, by just getting connected to the D9, you're talking about almost 3 million Black folks, right? And we touch our children, our youth, middle school, high school, the boys. So I just think that there's a lot of wonderful opportunities. And as they say, we can't do it by ourselves. We need to do it together. So I am looking forward to connecting with y'all to be able to.
And the way we used to do in some of our communities, in my community, we used to do it growing up. You thought that you could beat it out of a person.
Right. Yes, that's true.
You can't. They said, that boy's so bad, I'm going to beat the devil out of him.
That's true.
That's one of the terms they used to use. You can't beat it out of a person. You can't pray it out of a person. You have to take the approach. I like the approach that NAMI is taking.
That is true. That's one of the things. First of all, I want to also give a shout out to Ms. Brown for having adopted a child with special needs and hanging in there and making and it sounds like that's what drove you towards NAMI. So that's beautiful. Most people would have tried to give the child back or whatever, and kudos for also and maybe we'll have you in another program to talk about foster care adoption, because that's also something that in our community we need to be doing more of. And if we understood the benefits and the perks that come with it, in addition to helping a young person, that would be wonderful. So I just wanted us to talk about.
If I could share with you.
Yes. Go ahead, Giles.
No, I was just going to say, if I could share with you also, one of the things that we're working on in New Jersey right now with the New Jersey Attorney General. And you hear his name in New Jersey, the Attorney General is the chief law enforcement officer of the state. So tomorrow he can cut a directive in every law enforcement agency, from the state police, prosecutors' offices, local policing, everyone has to follow that directive. It's not even debatable. All right. The power that Attorney General has. So one of the things we're working on now too, because we as Noble, we believe in the sanctity of life. If a person does something wrong, use the force necessary to take them into custody and then turn it over to the courts and let the courts deal with it. So what we're pushing them for now too is to use less lethal force when we have to. There's a number of less lethal options out there that can be used. It's not just your handgun or some type of lethal force. Less lethal force is force that can still bring the situation under control, but it's not intended to cause a death. All right. So there are a lot of options out there. So we're pressing them now to make sure. And the only reason why that discussion is being had is because Noble is at that table. So I just wanted to share that with you also.
So what are we doing? And anybody can answer this. What special efforts are being made for officers to be able to recognize that this is a mental health call, not a regular call? And can somebody talk about how that plays into the whole concept of defunding the police? Because everybody knows that that didn't mean pull the funding from the cops. It meant bringing other people to be responsive to those, moving those funds to other agencies and professionals to be able to respond to those calls. So anybody can answer any part of that question.
All right, I didn't want to monopolize too much time, but I'll address it. With the whole, I understood, because as I said, I came from an underserved community, and all that we've saw over the last 3 years of the questionable use of force that resulted in death by law enforcement officers, people were crying out. I had mothers coming to me that were afraid to send their children out You know, I mean, this was a very serious matter. They were wondering if their son went out, is he going to come back home? And I mean, I've seen ladies, mothers came to me in tears. That's how frightful, that's how afraid they were. But, and so I tell my other officers, I tell them, I said, look, you got to peel back the onion. All right. When people were talking about reallocation of resources, that's what they were really talking about, not defunding the police, but people took it and used it for political purposes, you know. But what they were talking about is that what can we do to address this problem? You know, because people at what's in, they're tired of seeing Black children, Black men and Black women being killed at the hands of law enforcement. You know, we always taught law enforcement is there to protect us. So, you know, that being said, there are resources that can be provided to police departments. I mean, there's just been millions of dollars by the Biden-Harris administration that has been put out to be utilized for community programming. So we have to be very cognizant of where those dollars are spent. I mean, billions of dollars have just been sent out and made available to communities through the COPS office and through what's called burn grants. All right, that's grants that local police departments and state police departments can apply for. They took those monies from the rescue money that was utilized for COVID, and now they transfer that over. That's why I say you have to be at the table, have to be very cognizant of where your tax dollars are going and how they're being spent. But I don't know if that answers your question somewhat.
Well, I guess the first part is the question I really want to hear also answered as well is there some special training that's happening to help to ensure that officers recognize that this is a mental health situation? Because we keep hearing on the news how, you know, these mothers or these families are heartbroken because they called the police to deal with, you know, somebody's psychotic episode, and they've told the cops that this is a situation, and still it seems that we end up in a situation of death. And that just has to be devastating, not only for the family, but I would imagine at some level the officer too. I mean, it's just a horrible thing. So what is happening so that, you know, are there steps being made that, you know, maybe we're going to put something in place where we have, you know, a 511 in those situations where people aren't calling the cops, but, you know, they're calling maybe a social service or a mental health agency, and then they can call in the cops if they need help. I mean, what's being done to move us away from these devastating situations?
Well, very quickly, in New Jersey, we've mandated now that all officers have special training in that area. Number two, as I said, we're working with the Attorney General now to make sure that there are less lethal options. All right. And also, too, the program is growing now that we've put into place, the Arrive Together program. So that's what's going on currently in New Jersey.
And North Carolina, Lieutenant Tait?
Yes, ma'am. So in Durham right now, again, it goes back to the CIT training. We started this years ago. It's been made mandatory that even the officers coming out, graduating from the academy, they have to go through this week-long training. And even when officers, I saw something in the chat, a question in the chat about it, if an officer responds to a scene and they recognize the need for a CIT trained officer, they will request it over the radio. It's as simple as, you know, requesting a CIT officer respond to the scene, and one will always answer up. Right now, we have at least over 60 officers trained on uniform patrol with the police department. That's just uniform patrol. There are still other officers in various divisions, such as investigators and community services division as well, that are also trained. So even if they're just out and about on a follow-up and they hear, hey, can I have a CIT trained officer to respond to the scene, they can still answer up and go to those calls.
I'm gonna bring on one of my friends who had a very interesting question. And go ahead, Ms. Brown, you can go. I see you had your hand up. But George, if you could turn on your camera, I'm gonna bring you on screen so you can ask your question that we talked about earlier. So go ahead, Ms. Brown.
One of the things, I just wanted to thank both officers, Tait and Ship, because I think the other thing that we would like to help do is to be able to help the community know to ask for a CIT officer. Many folks aren't. They just call, ask for an officer, and then explain that a person has a mental health challenge, but they don't necessarily request a CIT officer. And we've known that, you know, there's been an 80% reduction in like harm to officers and others when a CIT officer is in fact deployed. So on our end, through our community conversations, through Sharing Hope and Compartiendo Esperanza, the focus is to let folks know that they can call a CIT officer, because people really don't know. And so they do feel badly when that happens, but it's just trying to get knowledge to the community so that they're aware.
That's a community education issue that we all can assist in. George, can you share with them what were your concerns that you sent? He sent me right away this question. I said, ask it. So go ahead.
Thank you, Helen. And thank you to the entire panelists. I think your presentation has been quite moving in terms of educating us regarding this problem of mental health in our communities. The issue that I brought up with Helen has to do with I think it was touched on in your presentations regarding what resources are there to ensure that the police is fit for the job, not just at the time of entry, but every time on the job. Because we know that the issue of mental illness can be like any other kind of illness that sometimes does not give any long-term notice. So my question was whether you could speak to how the police institutions deal with the issue of ensuring that officers are fit every time. Is there a standard that that is used to implement a program? Not just, I hear the training side, but what kind of structure is there to follow how officers are doing? Recently, the BBC reported on the issue of rising police suicide in Kenya and some other African countries. And they report that job stress is a factor. So I don't know whether here in the United States, these issues are being considered and the programs are put in place to ensure that officers are being monitored. My other question has to do with whether or how you're following the data in terms of looking at performance across states and maybe across large metropolitan areas. Because following the data and the reports on mental health crisis and police brutality, we see that some cities have done well. So I don't know whether there is effort being made to follow who's doing well, who's doing poorly in terms of the data, and whether there's comparison to see those who are doing worse, why they are, and those who are doing well, whether there is some kind of system to learn from others in the process.
Well, I'll take a stab at the first part. You had a lot of different questions in that one question, but with respect to psychological evaluations, officers are given a psychological evaluation, and we can debate, I debate whether it goes deep enough prior to getting the law enforcement job. After that, there's no annual psychological evaluation. I think there should be. because people go through different types of trauma in their regular life and within law enforcement. I think they should be evaluated every year. Currently, right now, the only way that a person is given an evaluation if they're, for example, if they have a lot of particular incidents, and then that chief of police can send you for a psych eval or something in that. If there's some kind of behavioral problems that you may be having, they can send you for a psych eval. But I still believe that we have to take a better look at the way we're hiring folks and what type of people we're hiring initially. And any other part of the question, you can, as far as a national database on it, there isn't one. All right, and there's not a state database. That information is not collected. Now, you have chiefs of police and other groups who want to push back. They said it's going to be a costly undertaking. You know, they'll give you excuses upon on top of excuses, and until the community demands it, it's not going to happen, quite frankly.
You know, I had myself muted. I didn't realize it. I actually teach a course it's an ethics course to future human service workers, which is police officers, social workers, probation officers, social work, the whole bit. And I'm very impressed to see that throughout their studies, there's a lot of emphasis now on self-care and mental health and taking care of yourself. And I'm impressed with your honesty that it's not an ongoing issue in policing. And you know, these are stressful jobs, whether you're a social worker dealing with all kinds of stuff, you're a counselor, and it's a part of their training, as a part of their ongoing staying gainfully employed, that you need to have a counselor. And I wonder if we've got, you know, this thing with the police departments where they're not wanting to acknowledge that an officer who is seen as having counseling, is there still the stigma that this officer is weak or not equipped for duty? You know, there's obviously gives ammunition to, you know, if there's a lot of complaints against this officer, like, I don't know if somebody can just jump in on what is some of, I think I'm guessing at some of what might be the drawbacks, but how do we get over those hurdles so that police officers, as others in the helping profession, are willing to acknowledge that you do stressful work and you got your own personal life and you need to be taking care of yourself in order to do good by others?
So one of the things, these are all very good questions, by the way, but one of the things that we have done in Durham is that peer support specialist team. It really makes a difference because some of us, like you said, it is a stigma behind therapy and mental illness, or I'm having issues that I cannot work out on my own. But if I can go to another officer, that actually may make the difference for a lot of officers. Some people don't want to go to therapy for those very reasons because of the stigma, but the peer support teams that are made up of officers, I believe those are actually helping a lot more. And then to go back to Mr. George's question, I know Mr. Shipp touched on it a little bit, but we don't have, officers aren't going through annual psychological evaluations. One of the things that we've done here in Durham, though, within the CID, Criminal Investigations Division, if you are an investigator or assigned to the Special Victims Unit or the Homicide Unit, you do have to, upon entering those units, you have to go for a baseline appointment to make sure that you are fit to do this kind of work, because the level of trauma and the level of what we see on a daily basis and what we hear on a daily basis can and will start affecting us. And so you have to do that afterwards annually if you were assigned to those two units. So we will be able, or the clinicians will be able to identify if there are issues if somebody's been assigned to these units for about 2 or 3 years after the fact, or 5 or 6 years, however long they're in those units, because of the baseline appointment.
And let me be clear also, I mean, there is all jobs now within the state level and local. They have what's called EAP, Employee Assistance Programs, but they're not mandated. We also have Cops to Cops, which is a peer counseling group for anybody. Now it's expanded into the military also, but it's with through Rutgers University Mental Health Department. So, but again, that's voluntary. You know, so there is no mandatory evaluations of officers on an annual basis. And the first excuse that they come up with, and I call the excuse specifically, I'm being deliberate, first excuse they come up with is that, oh, we don't have enough money to do that. But we find money for whatever we want to find money for.
Where do you find the most pushback from that? From the unions or from the rank?
The unions and the chief. Anytime you're trying to hold people to a level of accountability, there's going to be pushback, especially in law enforcement profession.
Right.
You know, I'm glad to see and hear what's happening down in Durham, because of you have people in place now who care about the people they're serving. So I think that makes a tremendous amount of difference, because in certain communities, when they need certain things, if you look at the opioid epidemic right now, for example, they're talking about dealing with it as a mental health issue, you know, or a medical issue. When there was crack and cocaine in our community, the answer was lock everybody up. Okay, so you're talking, both of them are substances. So, you know, that's why I continually say, and I will continue to say, it's important that we're at the table, because even when I work with the various different legislators and we go in those rooms, when these issues are being discussed and these laws are being promulgated, it's usually myself, maybe one or two other people, and the other folks have the rooms filled up and we're not there. You know? And it's the same way at the policy table. You know, you may have one of us at the policy or one person they pick to put at the table who they know is going to agree with their position that just looks like us. That's another game that's played. So, you know, we have to be a little more service and hold people to a level of accountability, and don't anything less than that should not be an answer.
Yeah, I mean, in the case of law enforcement where people are armed, I mean, this is a extra risk when you have police officers going on the beat, they are carrying guns. And so if you have a system that makes it voluntary, and especially on the issue of mental health, where it takes the mind to make the decision. And if someone is in a situation where they have, you know, mental issues, I mean, how would that person be expected to then make a decision that I need help? You know, even in the situation where people are in denial. But realistically, you can see that, you know, the tool they need to make the decision is defective. So then expecting that person to make the decision voluntarily, to me, increases the risk of, you know, crisis.
You know, it's probably going to take, and I don't even know how you get there, because I think, you know, we rely on different professions to self-govern. And the reality is that some are good at it and some are not. Most are not, I'll say. I'm a lawyer, most are not. And I don't know, it's going to take push from the public. And I heard Giles say he works with CBC. So it's going to take push from the public for our elected officials to address these issues. So anyway, George, thank you so much for your question. Kylthia, I know you had a question. I see Michelle has a question and we have 2 hands raised. Thank you, George. George will be back with us in a couple of weeks to talk to us about Liberia. Looking forward to that, George.
Thank you.
Thank you.
Yes, I had a question. I put it in the chat room, and DeLacy Davis did address it to some degree to kind of hear from the group. The recent 988 number around mental health, what's being done to educate the public around the use of that number instead of 911, I think.
Is that something exclusive to New Jersey or is that everywhere?
No, that was a national number.
Here in Durham, there have been community conversations around the use of 911 and how to utilize it and implement it. So we've been having those conversations here in Durham for the last couple of years and getting it out to the community.
988, I see DeLacy Davis is on the screen. Can you speak to it at all or anyone else?
Sure. Thank you for the opportunity and good evening to all my colleagues and everyone. So 988 was supposed to be launched as of July 16th, 2022 across the country. SAMHSA has actually put a couple of $1 million together for some of the professional learning communities. I am actually working with one of the teams, and we're actually meeting with about 6 states to help them launch and implement. Various states are at different levels of implementation, but the goal is so that people will dial 988 for a mental health crisis rather than 911. And different departments are doing different components. So for example, West Orange, New Jersey, when it's a crisis, they send a clinician with a police officer as opposed to a police officer by themselves. But we're really trying to ensure also that when they send them out for young people, that they're trained to deal with young people, that they're culturally relevant, that they are culturally linguistic. And so some states are very progressive and others are not. New Jersey has been doing it since about 2001. And so New Jersey is being used as the model for the rest of the country because we've always had a mobile response stabilization service. And so I'm a part of that. And also I run a family support organization in New Jersey. So we work with families of children with special needs. Thank you for the opportunity to respond.
Can you put your information in the chat, or if not, then to me directly, Kylthia?
I'll put it in the chat, absolutely.
Yeah. Oh, great. Dawn, do you have?
I just want to say that NAMI, our advocacy and policy team, is working with all 650 of our affiliates to be able to get the word out in the community around 988 in different languages, and to help folks, as DeLacy Davis was saying, just to make sure that it's, you know, linguistically responsive and appropriate so that folks can understand how to access it, that there's information on it. We're doing it via social media. There's just a huge push to make sure that we start to educate at the state and local levels to be able to make sure that folks are aware. And it's just rolling out, so it is a little clunky, but we are hoping to improve that. And then with Sharing Hope and Compartiendo Esperanza, to fold just that knowledge in, so folks, again, at the community level are just aware of 988 and how to use it.
And I can say here, I share with the community, the planning group, that Duke, I used to work at Duke, and Duke University sent out an email, I guess, to all the employees and past employees announcing the 988 number hotline for mental health. I thought that was amazing. So if universities could start to send it out, you know, across the country, it would be really helpful. And if I may, I didn't have a question, but I know we had said that we would honor this question in the chat. It was from Annette. But Annette, let me come back because I know Mr. Thomas had his hand up for quite a bit. So if he could go ahead with his question, and Annette will address yours about police officers taking an oath to protect and serve. So if we can go in that order, that'd be great. Thanks. Mr. Thomas?
Thank you. Good evening, everybody. My question, I was teaching a class to help young men then, and there were no women, but to help them become police officers. They were having problems with the test, and we were trying to help them to be able to take the test. During the class, I sort of identified an officer or a candidate that I thought was unsuitable. The whole time we had the class, he kept talking about, got to get that gun, I got to get that gun, I got to get the gun. It became so obvious that he was more interested in getting the gun than really becoming a police officer. At the time, I reported this to my state police partner. I said, I'm afraid to have this guy become a policeman. I don't want to meet him in the daytime, let alone meet him at night with a gun. The officer told me, don't worry about it. The screening will find him and take him out of the program. 3 years later, I find the same guy on the street with a gun as a police officer. And his idea is the gun solves all problems. Everything is solved with a gun. I'm wondering, is there some sort of mechanism that will do better screening to keep people like this off the street? I guess that goes to Mr. Giles.
Yeah, as I said earlier, I have questions regarding the psychological evaluations that's given to people prior to getting on the job. It needs to be deeper, not only in that regard, also for folks who may have have a philosophy of white supremacy. We're not just going to stop there, but I mean, we have to do better. Currently, the system that's in place now, the department pays an individual to do psychological evaluations, and pretty much if the department wants that person to come through, they come through. We have to have a better process and if you're paying me, I'm not going to stop so many people from coming on your department if you're paying me every time I come to get another evaluation. So we really got to think that we have to think it through, and we have to do better in regards to that, because we have to really go in depth. The federal law enforcement agencies now, they do a very, very thorough background and a psychological analysis as it relates to people coming into their organization with white supremacist ideology. So as I said earlier, we have to do better. It's not, as far as I'm concerned. And then we have to yearly evaluate folks. I mean, there should be a yearly examination, not only for mental health, but physical health.
Thank you. I mean, it's just a fearful thing to think that this guy's going to come to call at your house. Mm-hmm. If anybody yells at him, he's going to go for the gun. Mm-hmm. He's not going to try to talk you down, and he's going to end up with somebody laying on the floor bleeding because he's afraid, and all he can solve things with is his gun. And that's really scary.
Yeah, we're also pushing, what we found is that generally people who are less physically fit, people who are less culturally competent, and people who are actually on the job for the wrong reasons, I'll leave that right there, are usually more apt to go to their weapon as a first option. They don't want to get involved in a fisticuff. They go to that as the first option. We're trying to push now for more physical fitness training and more annual testing of law enforcement officers in that regard also. But the unions are pushing back, and the unions are a very strong lobby. I can tell you, in the state of New Jersey, they're a very strong lobby, and they've been able to, contribute to elected officials. They've been able to, gather a lot of political clout, and that's the reason a lot of these things go. I'm gonna put it this way: unresponded to.
Yes. Thank you.
Okay, if we could, I know Annette.
Wait a minute, hold on 1 second. I didn't realize I was on mute. Sorry, Michelle. This is a perfect segue to direct you to the link that I dropped in the chat. You'll see it's called, it's a film by Gloria Brown Marshall, and it's called Caught a Shot. I encourage all of you to watch it, particularly those of you who are working in the field. It's a good training tool, and it's specifically about a cop who shot a young Black man, and he is haunting. There's a conversation that's happening between the cop and the officer. And it even touches on mental health, because the officer clearly needs mental health, and he's got the union telling him why he cannot do it, and he just has to deal with it. He can't talk to anybody about it. The film is just perfect, and it fits into the work that you all are doing. And those of you who are listening, you will find it very informative as well. So that's a shameless plug, because I love my sister, for Gloria Brown Marshall, who has been a guest of ours, and she's on the radio every Tuesday morning on WBAI, so you can listen to her at 9 a.m. And our wonderful Linda often fills in for her when she's not there. So anyway, I'm sorry, I just wanted to do that. So go ahead, you ladies.
Helen, this is Donna. I would like to know, would you repeat that title again? Is it Caught a Cop? I don't know why I can't hear you. I can't hear you.
I know you can't because I was on mute. I'm sorry. I'm going to put it in the chats again. It's called C-A-U-H-T, S-H-O-T, and it's on YouTube. So I'm putting it in the chats again. But go ahead. I'm sorry. Thank you, Donna.
Okay, thank you.
No, I just wanted to, so it's Michele, I just wanted to address Annette Day, have her question addressed. It just says in the chat, she had asked, we had said we'd put over to the Q&A. Is it true that police officers do not actually take an oath to protect and serve? And then she's going on about, is she on the phone? Maybe she can address it, her own question, but it says, I'm thinking about what happened in Florida with the schools and the police officers not going into the school until after the tragedy was done. So much tragedy. So could anyone address that?
Well, you do take an oath of office. I can speak specifically for the state of New Jersey and most agencies throughout this nation. Yes, you do take an oath of office. Now, the question becomes, is who going to hold that person to any level of accountability? That's the question, and it's a fraternal organization. I've worked in suburban communities. I've worked in urban communities, and it's a close-knit family. So that's one of the only government entities that does not have a board to watch over it. That's the only government entity. Schools have boards, educators have boards, lawyers have boards. Every other profession I've been involved with have a governing board over it, except for law enforcement agencies.
And there are citizen review boards, but they don't really have a lot of clout.
They don't have the power to subpoena. We just went through this in New Jersey, and we have a progressive mayor in Newark, New Jersey, Raz Baraka. He was trying to push for the civilian review boards to get that, to have that power. But again, the unions pushed back, and the couldn't get all of the votes in the legislature to pass it.
Okay, I see Anastasia, your hand has been up for a minute. You're with us.
Hi, thank you, Helen. Hey, everybody.
How are you?
I'm doing really well, thank you. Thanks for having this call. I did miss the presentation itself. I was running a bit late, but so forgive me if anything I ask or mention has already been touched on. But I just wanted to share a really quick personal story. So I live opposite a homeless shelter for women, and that has been an experience. Mind you, I'm an immigrant from Trinidad, so I'm not born and raised in the US, and I wasn't as familiar with the hood until now, because I apparently live in the hood. And so the homeless shelter is opposite my apartment, and I have the perfect vantage point for all of the drama that goes on over there. And one night, it was about 1 a.m., I was woken up, and then I looked out the window. There's a whole commotion. There's this woman, and she's screaming, ranting, cursing out the staff. The staff's trying to calm her down. She doesn't want to be calmed down. And one of the staff, a man, he kind of aggressed her. So she was aggressing him. She was gesturing, calling him N-words, whatever. And then he decided to fight back, because she did swing at him. So he fought back, and he starts beating her. They end up on the ground. He's on top of her, beating her. It comes out of my sight a bit, but she's screaming bloody murder. And she's screaming, call the police, call the police. Of course, the police were already on their way, because I realized how this shelter handles things is they just call police regularly. And so the police came. By the time the police came and they start walking in, the guy lets up off of her like this, he didn't do anything. Nothing's wrong. She's crazy. So he walks away. The police walk up to her now. And so, of course, she, isn't the most believable person in their eyes. she's the homeless woman getting kicked out of the shelter for whatever reason, right? So the police automatically, from my perspective, take this position of like, okay, they gotta handle her, the problem, you know? So she starts claiming, oh, he beat me up, he assaulted me, arrest him. Ignored completely. He obviously is like, he doesn't know what she's talking about. So next thing I know, this continues to escalate because the police decide to manhandle this woman and start to just drag her around, like by the neck, by the body, pummeling her, pushing her around. I'm stunned because I don't know how it got to her being brutalized twice in one evening for what I don't know. And so I had to go over there. I could not live with myself if I didn't go over there and say something. And I knew that was the most irrational thought I could have had. But like, I just felt like if that was me, they would have done the exact same thing by virtue of what, being a Black woman, right? Because I don't know if they would have done that to a homeless white woman. So I went over there, I said my prayers, I said, God, just be with me. If I die, I'd rather die, doing what I believe in than live a coward at this point. So I went over there. By this time, she's flat on the ground on her face, and about 2 or 3 of them kneeling on her. So I was completely perplexed. So I started saying, do you really need to do that? Like, do you really need to? She's in pain. She's, of course, screaming. They're like, no, she's not in pain. She's not in pain. I'm like, she's screaming in pain. Her face is being pressed into the concrete. Your knees, as grown, chunky men, are on top of her. But of course, I'm already intimidated because these are officers. It's 1 a.m. I have not minded my business and I'm over there at an altercation scene. So then they were like, wait, who is this woman? Who is this? The staff starts to say, oh, we don't know who she is. She's trespassing. So I see the staff member who brutalized the woman. And I say to him, I saw you. You put your hands on her. You should have not done that. You did beat her. You should have not done that. By this time, both the cops and the staff are totally done with me, totally annoyed. They're trying to say I'm trespassing. And one thing I noticed, okay, I'm wrapping up the story now. One thing I noticed, the officer, the woman, I think she had spit on one of the officers, a white officer. He was so disgusted. You could have sworn this woman was the devil's spawn. Like I got the impression that like, as an officer, he feels like she is the thing that's wrong in society. That's the level of disdain that these officers treated that woman with that night. I've never seen anything like it in my life. Like she, as a junkie or whatever she is, whatever's problem she's going through, she's the problem in society that he, as an officer, took this job to try to fix. That's the impression I got. That's the level of hatred I saw in his eyes. And that's what it took for them to brutalize this woman after she had already been brutalized by the staff. So
kudos to you for doing what more citizens should do. And intervene. I don't have a problem with you not minding your business at all, because it is your business. It's all our business. And the more we sit back and allow these things to happen, the worse things are going to get. So I don't know what the officers say. And maybe we should hear from you all, but I say kudos to you.
Thank you. To wrap up, the question in all of that is, I ended up emailing the organization, the nonprofit that's in charge of the shelter, and told them about this incident, got a response, whatever. But then I was like, should I email the police? Are they gonna give a single damn? No, they're not. So I was like, I ain't gonna waste my time, because if I email the police and then I put myself out there, my name, my email, what if they track me down? They don't make joke about people who try to pull them up. I'm not playing those games. I didn't know if I wanted to take that risk. I didn't know if it would have helped by like, okay, they're going to be aware that the neighborhood is watching. Maybe they should treat these women in the shelter better. But I just didn't do it at the end of the day. And so my question is, do officers have any sort of training or knowledge on the concept of how the hood came about, or how like government and society has been structured to ensure that certain Black and brown neighborhoods are more impoverished, more disenfranchised, more likely to have crime, more likely to have drug use? Like, that has a historical reason for it. And it's not just that those people made terrible choices and they just like gang culture, they just are good for nothings. Like, that's the impression that I get from about the mentality of police in general at large. And I wonder if that's by design. Like, you need officers to have this flawed thinking and to be completely ignorant of historical facts and socioeconomic realities in order to treat those people like a secondary class, you know, in order to brutalize them the way that they have. So that's my question. Like, where is the police's
compassion,
consciousness of why situations like homeless shelters are as bad as they are? You see what I'm saying?
Can anybody answer that? Abina, I know that you're not an officer, but I'm just trying to draw you in. You have any thoughts on that, just from what you do?
I do often tell the neighbors that I engage in my clients that I'm not an officer. And when I worked in CIT, I would definitely say that. I will say though, more times than not, I have encountered positive interactions when engaging in being out there with law enforcement. I think with anything, you're going to have those that know the history and they still choose to do whatever they want to do. And then you have those that know and they treat people as neighbors, they treat people as human beings. So I think with anything, with any agency, department, social service, teachers, I mean, you're going to have those that simply need healing themselves. And so they're going to interact and engage with folks because they feel that they can do so in all type of ways. So I think there are trainings, and I can only speak for my time here in Durham, because when I was in DC, I didn't work with law enforcement, but I do know that the trainings that they get, the mental health training that they have to do, the CIT training that they have to do, they are aware. The community services department, the engagements here in Durham, PALS and different things, like they have some understanding and concept of the history. I think it truly just comes down to feeling empowered and treating people not as whole.
Mm-hmm. Lieutenant Tait or Giles, can one of you address civilians intervening in these kinds of situations? What is your take on it? A yes or a no, or at your own risk? Or
one of the things that I think that civilians don't do enough of is report the incidents, because, and I understand the reason why, you know, they can be intimidated. It's an intimidating process. But what we have done here in New Jersey now, if you report that incident to the Internal Affairs Department, within 30 days, there has to be a response. Now, that doesn't speak to what level of accountability that's going to be involved in the process, but at least it'll be on record, you know. And now, if they don't respond within 30 days, the Attorney General takes over the investigation, or they intervene.
Is that a response to the civilian who made the complaint?
Yes, correct.
Oh, wow, very good.
Yes, and that's a new policy that's in place now in New Jersey. But, you know, if you don't complain, And if you don't, you know, advocate, nothing's definitely not going to happen then. It's going to continue to be business as usual. So
what do they say in New York? If you see something, say something. So you said something. Lieutenant Tait, what's the situation down in Durham? How do you all respond to civilians, you know, who walk up on the scene? I lived in Harlem. It was nothing for me to walk up on the scene and say, what are you guys doing? They threatened to, yeah, I don't know. Luckily, I never got arrested, but they always say the same thing. You're interfering. This is police work, you know, that kind of thing. But what are you all doing down in North Carolina?
I think it's how it's done. We've all been on scenes where somebody from the community might come up and it's already a hectic or chaotic scene. We're already dealing with a situation, and we've had people that will come up yelling and cussing and that kind of thing and trying to get involved, which I wouldn't advise that. But it's nothing, if you have a concern, especially after the situation has calmed down, because at the end of the day, we don't want you all to get injured either, because we don't know what we're dealing with if we're still trying to de-escalate a situation. There's nothing wrong with afterwards going to an officer and just asking, like Ms. Helen just said, like, well, what's going on? What are you doing? You have that right. If you see something, though, that you don't necessarily agree with, or you think that someone's rights have been violated or officers use excessive force, you can always file a complaint. You can do that. Well, in Durham, I think every agency is different, obviously, but in Durham, you can file a report with the supervisor that's on duty. People have actually called 911 and said, I want to speak to the supervisor who is working and who is supervising these folks at this particular intersection right now. And the supervisor has to call and at least get that process started. If you want to file another complaint, you can file with the Internal Affairs Division. And sometimes it might go back to the supervisor who is in charge of the officer that you're complaining on. But if you see something, you definitely need to report it. That means that we will at least have a track record or some kind of record of the issues that you all have seen out there. I hope I answered your questions.
And if I can just add to what you shared, Lieutenant Tait, I want to just add with the Community Safety Department, our folks have been trained to also be advocates for our neighbors and to step in. And there have been a couple situations, not a lot, where our peers and our clinicians have stepped into the space to protect our neighbors and to talk with officers about just a little bit aggressive behavior. So, you know, in addition to civilians doing it, folks within the unit and the departments can also, you know, do that as well.
Let me give you a quick example. In the George Floyd murder, all right, if the community had not got involved, that would have been another incident that was swept under the rug. If they did not videotape it, if they did not make the necessarily, you know, the comments to tell them, to demand, that would have been, and also, of course, we had a good attorney general in place as well that prosecuted the matter. But for that community or citizen support, they would still be out there brutalizing people on the street now. And I'm just going to say brutalizing people because he has a track record of brutalizing people.
Absolutely correct. Thank you.
Yeah, I tell you, with that whole George Floyd thing, I mean, coming from a lawyer's perspective, those 3 rookie officers should sue the city, the state, and everybody else for allowing that they were put under the tutelage of someone with such an extensive history of abusing the public. So I might be doing time, but I'd be suing the heck out of, you know, the city and the state for putting me in harm's way. Because he did have such an extensive record. Ms. Brown, you're in California, so we know you all are trendsetters out there, I'm sure. What is the deal with civilian, and do you know, I didn't even know if you could speak to it or not, civilian intervention in these kinds of matters, and do you agree with what Anastasia did?
I mean, I definitely think it's important. I can't speak too much to a lot of the work that's being done out here. I'm not as involved, I have to say. I am working with folks like Axon to do police training around interactions with folks who have a mental health challenge. So I've been doing that prior to joining NAMI. And I think that there's some promise there. I don't think that they've really gotten to where they can be and should be. Mm-hmm. But I think, you know, they're definitely looking to do that. Our police chief out here in San Jose, I can speak of, works a lot with pastors and faith leaders to make sure that folks are able to share, to complain, to get involved with these kind of injustices. And there's a lot. The pastors out here are very, very vocal, and they're very involved. So I think that they often get invited into these conversations just to make sure that they kind of check the pulse out here for the San Jose Police Department. But
somehow we have to be more proactive. You know, the community is outraged after it happens. And I had started this thing and I stopped working on it, but I just called it Between the Incidents, because they already know what's going to happen. Something's going to happen. The Black community is going to be angry. We're going to have a protest. You might burn a building. You might whatever. They're going to give you a chief diversity officer or give somebody else a great position. And they'll do it very publicly. We'll be quiet and it'll go away. And that's the problem. We need to keep the pressure on at all times and be proactive between the incidents and not wait for things to blow up. And we need to stop being as predictable as we are in our response.
Right. So. And I think they are trying to do that. We have the African American Community Services Agency. They work a lot with a lot of members of Black sororities and fraternities in leadership and law enforcement and public facing jobs to be able to really address this. And again, as I said too, that pastors are very much involved in getting invited to the table to kind of talk about how do we get in front of it. And then once something happens, how to address it and respond as well.
Yeah, I get concerned about the whole pastor involvement because we have this faith-based funding. And I think the faith-based funding in many ways has served to silence the churches about things that they normally would have brought to our attention. We don't own our radio anymore. So, you know, having conversations in radio is a problem. And I love our Black organizations, but when they take money from, you know, these entities that are discriminating or whatever the case may be, they take it and then they treat it as hush money too. And the thing is, you just need to say, we accept your donation and we accept it in the spirit that you support the work that we're doing. Not that we're going to take your money and we're not going to talk about the 100 people that you just fired who just all happen to be Black. Like we're going to make an excuse for it. We're going to blame the victims. So we as a community have got to be more creative in our response to all of this, because we all play a role in it. We can't just look to you people who are doing the work, but we all have a responsibility. And that's why I support what Anastasia did. And you know what? And if that's not your thing, if you're not the one to get out there and get involved and say something, then please support the people who do, you know? And that's just my soapbox for the day.
Yeah, and in the state of New Jersey also, you can make that complaint anonymously, you know. So I mean, people can, you know, help in different ways. But I would love to have Anastasia in my corner any day. Fierce fighter.
Thank you. Can I ask a bit of a provocative follow-up question on that? Mm-hmm. Since we did bring up George Floyd, I think that's actually what motivated me to go over there, because it felt so, I had told myself if I was there on the scene, I might have tried to do more than what the dozen people on the scene did. But when I went over and I was in the moment, I was like, I ain't gonna do nothing. You don't
want to physically intervene because
that's my question. But if someone had physically intervened, if multiple people had physically intervened, I feel like George Floyd might have still been alive today. Or are you saying that the police are that violent that they would have actually shot multiple people for trying to intervene?
That's a possibility.
That's a possibility.
Mm-hmm.
That to me is like terrible, you know? So we're saying it's better for George Floyd to die than for police to recognize that multiple people are trying to intervene. Maybe we're doing something wrong.
Well, you know, I think, and I'm not a lawyer, obviously, but I think that from my perspective, this is my personal perspective, is that unfortunately we lost George Floyd, but we might have lost many other people if they responded and wouldn't attack the police. Because you got to understand, you're talking about an organization that has institutional racism built in it for years, since its founding. And, you know, that would have gave them the excuse to say that these people attacked me, and none of the four of them right now would be in jail. They would have said, these people attacked me, and we just responded how we were trained.
But George Floyd might have been alive. Multiple people would have just been injured.
Go ahead, Lieutenant Tait.
So I think also when it comes to intervening on that level, people, again, this, I can only speak for Durham and what the citizens have done here, obviously. They do not have any issue with getting on the phone and calling 911 and telling the communicators what is going on. And what that will do is the communicator will have to broadcast that over the radio, so that will alert the supervisors and other officers on the scene. So it's, if they call for backup, I don't know if they did or not. I know there were 4 officers on that scene of George Floyd, but if the officer called for backup, they already know it's a problem. Officers are coming. But if there are people like Miss Anastasia, if you on the scene and you say, you know what, that doesn't look right, I'm going to go ahead and call the police. Call the supervisor, now made aware because of everything you were saying. That also goes into the call notes as well, and they're broadcasting what you are saying over the radio. So this, it's not just going to be officers coming at this point. It's going to be supervisors as well coming to that scene, who you will be able to talk to.
Is the media hearing that as well? What they used to call them back in the day. People used to have them in their house and they would listen to them.
The scanners?
Yeah, I guess there was a word we have for them. But yeah, so are the media, is media connected to that?
Some media, yeah, if they have a scanner, they can hear it.
Mm-hmm. Nowadays, there are scanners you can get as an app on your phone that are keyed to various cities. So you pick the city whose police frequency you want to monitor.
And you can hear it? Oh,
yes.
My. I'm trying to think what those boxes were called, because a lot of family people just had them in their house, and they would, yeah, I guess a CB radio, I don't know, was it CB radio, Giles?
Well, the scanner for law enforcement calls. CBs were more of a communicate, it's almost like a walkie-talkie in your vehicle.
Yeah, I grew up in a small town, and a lot of people just knew everything that was happening because they heard it in progress.
They're probably thinking about a citizens band radio.
Yeah, I guess.
Sometimes they broadcast
I
things
can't
like
remember,
that.
Yeah. Anyway.
But we always tell people, you know, even when, especially when we talk to younger people, we tell them to make a note of, you know, where you are. Any identifying marks on a police car, if you can see a badge number or a name, the time of day, anytime a police vehicle is dispatched to a call, there's we call a card punch. It's the automated data system. It's recorded. So we tell people just to make a note of what you're seeing and what you heard, and then report that back to that law enforcement agency, and especially with younger people too, because they may be a little more emotional, not knowing how to handle those different specific situations. So we tell them, you know, be polite and courteous, you know, but because if you don't, you're going to escalate the matter. Now there may have been a situation where you were shoplifting or some matter that we can handle or your parents can handle. But if you escalate that situation in New Jersey now, for example, if you touch a police officer, it's an aggravated assault charge. So now you not only have that initial charge, which might be a local ordinance, now you have aggravated assault, and the officer's going to hit you with resisting arrest, and you could be looking at jail time. You know, there's a presumption of jail time. And now they're trying to, in New Jersey, they're trying to make, if you assault an officer in any kind of way, they're trying to make it a second-degree crime.
Wow.
That's what the talk is going on now. So while at the same time, the governor has formed a criminal sentencing and disposition commission to review why there's so many Black and brown people incarcerated and not any other people, when it's the same level of criminal activity being committed by all ethnicities and races.
Absolutely.
Linda, Ellen,
I'm sorry, what was that?
I was sitting in court for a while. Somebody told me about something, and to find out, I just went to court myself. And I found out that the officers who were making complaints against certain suspects were using a form. So in other words, it was like fill in the blanks. They had I think 3 guys. Everything was identical except for the name, the date, the location, so forth. But it said the same thing. I saw them with drugs and 1,000 feet of the school, blah, blah, blah. And they dropped the drugs when they ran away.
No, shame on the courts for not recognizing that and addressing it. Thank you, Lenny.
A lawyer did see it, did tell the judge. The judge went back and vacated all 3 of the complaints.
Oh, okay. Cool. Good ending. Good ending. Linda.
Hi. Hi, everyone. Hi, Giles Ship. How are you?
Oh, good. And you, Professor?
All right. This question is for you in particular, but other people can jump in, because you give, particularly Giles, you've given a lot of information that I don't think the public knows. So from a media, public relations point of view, what is being done in the state of New Jersey to convey this information to the public? And I would just suggest that the information, short bullet points so people can get it really quickly. So I wanted to know what public relation is going on. Particularly, I don't see it on the radio. I don't hear it on the radios. I don't see it on buses. I don't see it on bus stops, where particularly Black people, this is where they are. This is what they look at. Not just social media, but there's other things. So I'm wondering if the state of New Jersey has a budget to ensure that there's a public relations component to educate the community, and not just like you have to take, do a curriculum or do a session or do a class, but it's ongoing information so people know, file a complaint. Like you said, this information is available. If nothing's done, then the AG is going to step in. People need to know that. And it shouldn't be just you going around sharing this information with people. It should be ongoing, continuous marketing like they do for elections for this, particularly for our community, whether it's in Durham, I had to say that, Quincy, or wherever, that this information is quick, dirty, to the point in places. And again, people shouldn't have to go to church to get it. It should just be there constantly, right? And the state should be paying for the advertising, because our tax money pay for the police officers. It can also pay for the public relation and the media component to keep us educated. So, I really commend you. I know you and I do a lot of stuff. We're going to do something pretty soon, but yeah, we need to put pressure. And the other part, Helen knew I was going to say this. I mentioned it before. That's why civics is so important. Yes. Because if you don't know how to make government accountable, and Giles needs to help. If more people understood how government works, if they understood the money is involved in shutting things down. I walked away for a minute, but somebody was talking, I think Helen was you, talking about the kind of money that that people, where they put the money, that it's just so much. But one person here and there in Quincy, Miss Dawn Brown, all of you are doing such a good job. But the state, our taxpayer dollars should go towards that. And the only way it's going to happen, we have to make them do it.
That's right.
You have to make them do it. And the only way you can make them do it is you understand the language of government and politics, so that you understand what people are saying in the first place, and then how to make them accountable to you. Giles talked about how the police officers, they make elected officials accountable to them. They contribute to campaigns and whatever else they do. Get information on people. I say that because I'm doing a program on COINTELPRO. But the point is that we got to know how government works. We need to know the language of government and politics in order to make our elected officials who decide, because politics is about who's going to get your money, who's going to get the public's tax money. And if you don't know how to make people accountable, you're not going to get the tax dollars. So while jobs can push it, but the people in New Jersey should not be waiting. They should be putting pressure on their elected officials so that there's money available. So he's not one person giving a message. It's happening over and over and over again, where people just know automatically, oh yeah, I could file a complaint. Oh yeah, I could do this. I shouldn't have to think about it. It should be automatic. So that's my comment for today.
Helen, this is Beverly. Can you hear me?
Yes, we hear you, Beverly.
Sorry. To that end, the community organizations, the existing community organizations need to be demanding that of their local, representatives and so on, up the line to the governor's office. The churches, all the various and sundry community organizations that already exist. Yeah. And it needs to come from that, and it needs to get out there if it can in the media too, so that the general community is aware that people are looking for this information.
Yeah. Let me just quote this African proverb also. If you think that one person can't make a difference, sleep in a tent at night with a mosquito. Right?
That's right.
And I'm going to tell you, you know what? We can't necessarily rely on these organizations, because when I grew up during the turbulent times of the 60s, organizations were different. Now, unfortunately, a lot of organizations, if they give 2 or 3 people a job, it stunts the advocacy of that organization. Wow. So individuals can also make a difference, but you need forward-thinking people like that are on this call to call up, band together, and just, this no is not an, my mother used to tell me all the time, she said that failure is not an option.
That's right.
So you just got to keep the pressure on them, and you'll get results, because the squeaky wheel will get the oil.
Absolutely. And I see Miss Brown is saying that she needs to sign off, and we actually need to start wrapping this up. Did you want to say a few parting words before you? Wait, but hold Miss Brown has the floor. Miss Brown, did you want to say a few words before you leave?
I just wanted to say thank you. It is a pleasure sitting in company and community with y'all. Y'all are doing dope work. This organization is amazing. I look forward to just continuing the conversation. I wish I could stay. It's so rich. Unfortunately, I just have another meeting, but yeah, thank you. Totally.
Thank you so much for your time. I'll add you to our list, and we meet here every Sunday. Drop in whenever you want and contribute and invite people. We have men here today, but most days it's just Black women vibing and taking care of each other. So please come again.
Will do. Thank you so much. Okay. Deep out to you all.
Thank you.
Thank you.
All right. So on that note, I'm going to ask the rest of you if we can get some closing remarks, and then we're going to thank you again and say good night. And you can go in whatever order you wish.
I have my hand up, Helen.
Oh, I'm sorry. Who is that? Diane? Diane. Go ahead very quickly, Diane. What's your question?
I wanted to ask him about the Norcross safety package that he's promoting right now. Is Mr. Shipp familiar with it?
Unfortunately, I'm not. The only thing that I know that they're doing right now is they're utilizing the federal grant money that was dedicated to COVID and the American Rescue Plan. They're using that now to hire police. And
so it kind of says, voted for a package of 4 public safety bills to prevent gun violence and keep our community safe. And I was just curious, is that really for our benefit, or is that just to sell votes?
Yeah, usually what that means is let's lock up some more Black folks.
That's my thought.
I don't want to say that. That's not the gospel. I haven't read it, but I mean, you got
truth shall set you free.
You got to be very cautious of these. I can tell you this: he hasn't spoke to Noble about it.
Okay.
So if you really want to make improvements in the community, I don't know any Black groups that he spoke to about it. Maybe
of course not.
It's funny when you deal with law enforcement issues and in the Black community, they go, and I love my ministers, don't get me wrong, but they go and speak to the ministers. But if you deal with law enforcement issues in other communities, they go and speak to the community.
Thank you.
Hi, I have one statement. Can I just make brief remarks?
Yeah, who is that?
Please. I go by Element. I'm from New Jersey. I listen to the program. Very interesting. Peace to you all. Now, I was thinking or have this knowledge as far as mental health issues in our community. Sometimes it could be a debilitation, not just with trauma, but diet, and also the lack of knowledge of self. Because if we don't know who we are, you're going to be lost in the world. So that is important. It's an important key because everyone else, they practice their cultural stuff, but especially broken Black Americans, that is one of our issues. We don't really know who we are because we are a blended people and a broken souls in most cases. So if we get our nutrition right, especially for some of our people with the mental health issues, and they just need love as well, that may help. You know, it's also important. And another aspect I wanted to bring up, we're not on code as a people, and that can be an issue. And that's why a lot of us are not showing up at these meetings so that we can get together and make sure that the cops know that we know what's going on. And we want our rights because they are here to protect and serve us as a people, because there are plenty of us that work that want to keep our communities healthy and strong. And another thing is we have to stop being so inclusive because this goes back when everybody keeps saying Black and brown. We have to focus on us. I don't see a lot of those Hispanic organizations focusing on us. They focus on themselves. It needs to just be Black only. If just like when they need us, when we need them, then we bring them in. But they don't never include us. We have to stop and focus on self. Love self. We need to reprogram ourselves to love ourselves and love us enough to focus on us. And that's all. Thank you for your time. Peace and love.
And your name was Bellamont?
No, Element, like periodic table of elements.
Oh, Element. Love it, love it. And I agree with you. I think very often that as Black people, we're so inclusive until we look up and we have effectively displaced ourselves from the very tables, conversations, and opportunities that we've created for ourselves. And you're right, other people do not do that for us. So we got to take care of home first. So thank you for that. But on
yes,
that,
and I just want to say it's the programming, and we've been programmed to do that. Right. We've been programmed. We got to break that programming.
Right. Yes. Is Miss but I'm going to mess you up. Benna, you have to go. I saw you waving. So we're going to do.
I do.
Okay. Well, go ahead. Give us your parting words, and thank you. Thank you so much for coming.
No, just thank you for having me. I have appreciated this and learning about this organization. And hopefully I will be able to jump in some future conversations and just engage with you all some more.
Well, thank you so much for coming, and have a wonderful week. Thank you for your time.
You as well.
All right.
Thank you.
And then there were two. Lieutenant Tait and Giles. So you all decide who's going next.
All right, she's on mute, so I'll jump right in. I'm just going to say, in closing, first of all, this is great. Glad we had this forum to get the information out. But I can't say it enough. You have to advocate, 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 and the system will respond. May not respond as quickly as you want to, but they will respond. And lastly, if 5 people, to go to Professor Carter's statement, if 5 people from this call were to call the Attorney General's office tomorrow and to say that I hear there's a lot of information out there, what are you going to do better, or how can we get this information out to the public? They'll have to respond.
Yep, absolutely. And Giles, you've been here at least 3 times, I think. And I just want to say thank you. Whenever we call on you, you respond. And please know that we really appreciate it and appreciate you. And vice versa, when you need any of us, there's plenty of women on this call who come from all walks of profession and life, whatever. Just let us know. We're here to support you as well. So thank you again for coming.
Thank you for having me.
Lieutenant Tait, did they mention that you're a West Point graduate? Did they bring that up in your bio? Because that's pretty impressive, I think.
Yes, ma'am. Thank you. I just want to say thank you so much for allowing me to come in and talk and just share ideas. I actually learned a lot while I was here as well. I think this group is, I think Ms. Dawn Brown said super dope. I'm going to echo that. I really, really like the work that you all are seemingly doing and just the conversations, because a lot of times we don't have these conversations. The information is not being put out there. We have the information, y'all want the information. There's always like that little bit of a disconnect, but it's truly been an honor and privilege to sit before you all today and talk to you all. And I hope that everyone has a great week. I pray blessings and peace to everyone on this call.
And we will see you in Durham, because I'm sure Michelle's going to come up with some program that brings When Black Women Gather to Durham. Yes, so we'll be looking for you.
And same blessings to you. Thank you. So I know she'll be calling.
Thank you.
You're welcome. Thank you.
So you co-host, you guys can close it out. I think today went very well. If you have anything that you all want to say. Angela, you've been awful quiet. What are your thoughts for today?
No, I thought everything.
She's frozen. Oh, no. I think that's why she's been quiet. She's having technical issues there.
I just want to thank the remaining speakers, because your contribution I thought was just awesome. And so I just hope that the participants on the call were able to glean some information and maybe have some call to action to think about things they might want to do, to further the cause. So thank you very much for your contribution. Appreciate it.
Yeah, absolutely.
And I echo that. Thank you. Thank you so much, Commissioner Shipp and Lieutenant Tait. We really appreciate you all coming and sharing your wealth of knowledge with us. Thank you.
All right. Okay. And on that note, hey, Giles, I want to ask you real quick. Are you familiar with Gloria Brown Marshall's film?
I'm not.
Oh, I strongly recommend that you watch it. I'm sure that you will want to use it in some of the training that you do.
Please forward that to me.
I will. I'll make sure and do that. All right, everybody. So on that note, I'm just going to say thank you all so much for coming. I appreciate that. And this is for everybody. Let me remove all spotlights and bring everybody on. So I just want to say thank you all for coming for another Sunday for When Black Women Gather. We will be back here next week. It's Lola's birthday. I'm not sure how, but somehow we're going to incorporate that into our phone call. We will be meeting online at 4 o'clock. And that's all that we have. Thank you so much. And I'm going to stop the recording. But before I do, can you all unmute and say it with me this week, please? Unmute, unmute, unmute. When Black women gather, amazing things happen.
Thank you so much.
Thank you all for contributing to our amazing.
Thank you, everyone. Thank you, Helen.
Thank you.
I'm going to stop.
This was wonderful.
Yeah, thank you all. I'm going to stop the recording. We'll hang out for just a few more minutes. Our guests, you're more than welcome to stay or to leave. It's entirely up to you. But thank you for another week. Hold on. Okay.